Many years ago, I started with a twitch in my eye and it got progressively worse, and for a long time I tried Botox and it was helping. But I do remember once having to pull over to look at directions on my phone for wherever I was going, and I was having a hard time seeing the directions because I was having to hold The surgery went great. It went no spasms since the surgery.
Hello, this is Dr. John Y.K. Lee, Professor of Neurosurgery at the University of Pennsylvania. The information today is not sponsored or provided by the university, but rather this is my patient and her story. You get to meet Colleen Kranick, who is a teacher, and she is suffering from hemifacial spasm. It starts with a twitch in the eye, it progresses to the lower face, and eventually it starts affecting the quality of life. During this interview, I want you to listen to three aspects of her story. Number one, listen to her describe her symptoms because they really center around reading, which is kind of unique. Number two, listen to her fears because I think this is very common. Obviously, drilling a hole into your skull and doing microsurgery, that's what I do for a living, but it's not everyday experience. And so I think she does a good job articulating her fears. And then number three, listen to her results. Her pain results were excellent. She had very minimal pain. She had spasm relief right away, which is not guaranteed. But and then I thought what was very interesting was that her friends really started to comment on how great she looked. Who's now 6 weeks out from microvascular decompression for hemifacial spasm, and I want her to just tell her story of what she experienced.
Many years ago, I started with a twitch in my eye and it got progressively worse, and for a long time I tried Botox and it was helping. It seemed to help less and less. I would have to hold my face to read. I'm a school teacher. I would have to hold my face to correct papers, and so he would see all this happening. So I wanted to make sure, honestly, when I was making it, that it was more quality of life than it was just that I didn't like the way I looked, because I didn't like the way I look in pictures anymore. I would only take pictures with my sunglasses on because my eye was more sensitive when I got my picture taken. But I really didn't want to approach it from that point, and my quality of life was definitely deteriorating, and that's what made me do it. And my quality of life has improved, and I still don't love getting my picture taken, but I never did, so.
My wife is like that.
You know, I've honestly been reading, which is something
I've
always loved to do, and it became difficult.
And there's no hand on the face.
Yes.
She's reading voraciously.
Yes.
Wow.
Right. So, and that's how, again, teacher, I have my summer off, and that's how I would spend it, just reading, and it became very difficult.
I think you bring up a good point. This is not a cosmetic surgery.
Right.
It's a functional surgery that affects reading. It affects sometimes even eating. Or
Right.
anything else it affected? Or?
Well, it's funny you say eating, because the other thing I would like to do is eat while I read, and that was worse. Times like that made it worse. I don't know why. I never really had a problem at all when I was driving, so I don't know if it was the distance, but I do remember once having to pull over to look at directions on my phone for wherever I was going, and I was having a hard time seeing the directions because I was having to hold this year's eye test, which was before I had the surgery. I couldn't see, and I told the doctor it's not that I can't see from this eye, it's that I can't keep it open right now to do the test.
Yeah.
So, and again, I'm a teacher, so having to hold my face while I'm helping a student or grade a lot of papers, and of course, the more stress I put on it, the worse it would become. So the longer I sat doing something like that, the worse that it would become.
But you did some interesting research
I did
before
do
this,
research.
and maybe tell your own story about the research.
I did research. I Googled both hemifacial spasms. I Googled about the surgery. I found a surgeon in Pittsburgh. I'm from 2 hours away. I'm from Scranton, which is 2 hours away from Philadelphia. I did not want to travel to Pittsburgh. I knew there'd be follow-up. So I then Googled the University of Pennsylvania, which I was familiar with, and found Dr. Lee and have been here since.
And your husband was telling me that you met me, but you were appropriately scared.
I was scared.
Yeah. And how did he convince you?
So, well,
She certainly wasn't scared of you.
Yeah. What was the scariest thing in thinking about going ahead? Like what?
Oh, 100%.
Yeah,
the drill. As soon as someone says, I'm going to drill into your skull, that was it. The drill into the skull was the first and thing that made me say no at first. And then I am not a big one to have, I don't even really like to take medications. So to know that there was something foreign in my body.
Putting the Teflon, you mean?
Putting the Teflon in. Yeah, that bothered me. But it's worth it right now.
Yeah. So in this video, you can see in the actual surgery, this is an endoscopic microvascular decompression surgery, and you can see that the opening in the dura is less than 1 centimeter. This cotton patty with green rubber glove there, the width of this patty is 1.2 centimeters, so the opening is actually smaller than that. You just saw the cerebrospinal fluid coming out. We need that CSF to drain. In order to do a minimally invasive procedure, you have to be right on with your bone opening. I have to get right up to the sigmoid sinus, otherwise you can't really get in. And then just by putting this cotton patty there with a natural fold, and it pushes the cerebellum away, and I'm protecting the normal brain under the cotton and under the glove because I don't really want to damage any of the brain. I can insert the endoscope now. If you want to see the real anatomy, click up here at the top. As I get deeper, you can see the arachnoid. The arachnoid is that beautiful silk spider webs that are suspending the soft brain to the adjacent brain, and I gotta pop into that, drain more CSF, and you can see the lower cranial nerves deeper. Now, as soon as I keep draining all this CSF, it's going to provide the natural relaxation that allows me to do more work. Now I'm bringing in single shafted scissors. This allows me to open the arachnoid, provide a better visualization, and this provides an excellent view once I release that. Now I have the 9th, 10th, 11th cranial nerves in view. I'm just dissecting the arachnoid. The flocculus is blocking my view. I leave the arachnoid over the 8th cranial nerve, which is the hearing nerve. You can't see the 7th nerve yet, but I know that the root entry zone is right there where that artery is along the brainstem, and so I know that I need to move that, and that's the offending problem. And immediately her lateral spread response, which is the correlate on the EMGs, that improved right away, so I know that that's better. So now I can start to get ready, create my space so that I can get the Teflon in, and here comes the Teflon. It's a shredded piece of Teflon that's kept very fluffy in order to position that so as to prevent the artery from coming back into view. Now, I'm not even seeing the 7th nerve at this point. I just know where it is because I've done so many of these surgeries. I do all the acoustic neuroma surgeries. I do all the hemifacial trigeminalneuralgia surgeries.
So this is the lateral spread response. I'm getting it from the oris muscle in the face and also the mentalis muscle in the face. Once Dr. Lee decompressed, I lost that response from oris and mentalis.
Now I'm going to bring in a 30-degree endoscope. With the 30-degree endoscope, we're able to visualize and see around the flocculus and see the 7th nerve. Okay, so I can see my Teflon. It's really hugging the 9th nerve at this point. Let's come back up. There's the 7th nerve. You can see it. It's beautiful. Go down to the root entry zone. There's the 8th nerve near us, 7th nerve, and you can clearly see it going into the brainstem. The root entry zone is clear. There's a little bit of spinal fluid. The Teflon is there. You can see that running parallel. It's a gorgeous view. There's no other vascular compression. I've decompressed the offending vessel. Great. You have relief right away, the spasm?
I had, after the surgery, I had not one spasm. Not one spasm after the surgery, not one spasm that day. And I will also say that I haven't said yet that it's very hard to recognize a negative. So every now and then, like when I'm recovering, I would read a book and it would occur to me at some point toward the end of the book, I didn't have to hold my face once. Or it was like weeks and weeks before I went anywhere and put on mascara. I put on mascara and I was able to do it, which I hadn't been able to do. So it was hard to realize that it wasn't there anymore until I started doing things easily.
And to follow up on one of her things with medicine, she really only took Tylenol 3, possibly, I think it was, for a few days. As far as pain medication.
I just took extra strength Tylenol, so.
Extra strength, and that lasted for maybe 5 days.
Excellent. Yeah, I think that one thing I've pioneered is the endoscopic technique, and what we published was that your pain afterwards is a little bit less, just because we try to do a little bit less invasive than other.
I couldn't even comment on the pain. Like, I don't feel like I had pain, so to speak. I took the extra strength Tylenol when I was supposed to take it, but I can't say that I ever felt pain.
Great. And then your hearing?
Okay, so I will speak to that. My ear was, as I knew it might be, my ear was kind of clogged, and I recognized it the first time I was laying in bed, and my, let's call it my bad side, was up, and I didn't think the TV was on at all. I couldn't hear it at all, and then I turned over and realized it was, but that's fine now. Like, I couldn't talk on the phone on that side in the beginning. I can't really speak to how quickly that went away, but it's gone now. It's perfectly fine now.
Yeah, I always tell people that you will have some fluid in your mastoid hair cells, and so that can feel like you're underwater for several days.
Right, that's what it
and
felt
then
like, yes.
That usually clears up.
Yes.
But there is a risk of actual hearing loss. But
I also knew that.
Yeah.
And I knew that going into it, so I thought, perhaps this is a side, but it's totally cleared.
You were telling me something that all of a sudden, now that your face is perfect, all these patients, all these family or friends are kind of
Yes.
commenting all of a sudden.
Yes, so I was at a party just last week where everyone was telling me how great my face looked and made me wonder what I looked like before. So perhaps it was spasming more than I thought it was, but everyone has complimented me since.
Well, very good. I look forward to this. Is a funny thing. I probably won't see you again because you're cured.
Everything.
Nothing to do, and there's nothing to follow. So hopefully you won't need me ever again.
Well, we appreciate
Yep.
you, and it went
Very
great,
much.
and thank you very much.
Great. Very good.